Why don't I exfoliate every day anymore? Well, for those of you who haven't seen me in clinic and listened to me talking, I suffered with spots and breakouts as a teenager and as a young adult as well. I think it's only up until my early 30s when my skin started to settle. Hello and welcome to another weekly newsletter with me, Dr. Dhesi. I'm here at Vysana. What am I going to share with you today? So I am going to share with you why I don't exfoliate every day anymore. I'm going to talk about skin barrier function and why I don't believe in exfoliating every day. And lastly, a roundup from clinic. So now that I've got your attention, please, if you haven't already, please do subscribe to our YouTube channel and hit the little notification bell. So every time I post a newsletter, it notifies you and I can share these hints and tips with you from clinic. Why don't I exfoliate every day anymore? Well, for those of you who haven't seen me in clinic and listened to me talking, I suffered with spots and breakouts as a teenager and as a young adult as well. I think it's only up until my early 30s when my skin started to settle. Now, my knowledge of skin at the time, even though I was a doctor, I've been a doctor since 2006, my knowledge of skin wasn't brilliant. Knowledge of medicine was developing, but over time, having spoken to lots of patients, treated lots of patients, and also treating managing my own skin conditions as well, I've realized that exfoliation, which is sometimes a very strong output from the skincare industry using AHAs and BHAs, it's not the best thing. So why don't I exfoliate every day anymore? Well, one thing is that when patients come into clinic, what they're telling me with their skin is that it's red, it's dehydrated, it is sore, it can be tender, there's redness that recurs, it fluctuates. Now that can be elements of rosacea, or it can just be skin dryness or dehydration. So now you can ask me, what's the difference between dehydration and dryness? So dehydration is an example of dehydration is when you have a shower and then you come out the shower and your skin feels really tight, like it's crying out for moisture, even though you've been in the shower. So that's dehydration. And dryness is where your skin is itchy and flaky, and in both cases, it can be red and sore. So why don't I exfoliate every day anymore? Why don't I advocate exfoliating? So unless we are in a particular time of the year, like in the summer, where we're getting a lot of oil buildup, then I think exfoliation should be done maybe 2 to 3 times a week. Now, this is especially true for anyone in their late 30s or early 40s when your skin is a little bit of flux, and definitely anyone in their early 50s, you shouldn't be exfoliating daily. There is no need to get the cotton pads out and exfoliate with toners. A lot of the toners now contain alpha hydroxy acids or very weak acids, and they strip the skin. And what that does is it disrupts the barrier function. Now, if you've got really, how can I say it, sort of healthy skin and a good barrier function, then what happens is that if you do exfoliate, your skin replenishes, it's resilient, and nothing will happen essentially. However, if your skin is irritated, you're perimenopausal, menopausal, or hormonal, or just that your skin's had a bit of a battering from the sun, say for example, like sun damage, then what happens when you exfoliate is you don't give your time for your skin to recover. So what I would recommend instead is using a cream-based cleanser. So I would do that maybe morning and night for the majority of the week, and maybe twice a week, depending on how your skin is reacting, then use a exfoliator. And we've always got good examples. Keep watching for more information on that. Not this week, but more. I will follow through with this thread. Now, you're going to ask me, Dr. Sunny, what, if I am going to use an exfoliator, which one should I use? As I mentioned, you can use a very mild polyhydroxy acid or AHA. We will be talking more about that, like I just mentioned a second ago. But the main thing is use a cream-based cleanser. And if you're unsure of what's happening with your skin, then why not try out our free-to-use virtual skin analysis? You fill out a quiz, a type form questionnaire, and then that will send you an automated email with access to skin analysis. That's what I was trying to tell you as I sort of went off tangent. So if you've stayed this long, thank you very much for listening to me. As I mentioned, exfoliating every day is not a great thing. Use a cream-based cleanser. And if you are concerned about your skin or you want to know more, then fill out our type form questionnaire. It's free. We're not going to try and sell you anything. What we will do is guide you on a journey. And once you've filled out the questionnaire, it gives you access to our free skin analysis tool, which you can use in the comfort of your own home. So thank you for watching this, and I hope you found it useful. Comments are appreciated. So last but not least, this is a roundup from clinic. So it's the Easter holidays at the moment, so clinic can fluctuate. I've been doing private GP, so medical screenings. We do offer that service as well in Vysana here in clinic, taking bloods, discussing them, looking at markers like your organ markers like liver function tests, kidney function, cardiac markers, basically a general health check using a blood test, which if you are interested, then please do get in touch with us. Otherwise, we've been doing a lot of skin boosters, a little bit of controlled exfoliation. So exfoliation in clinic is fine. I get to see your skin. We do it once every maybe 3 to 4 weeks, and that works really well using AHA, so alpha hydroxy acids from Neostrata, or we use lactic acid, which is also a type of beta hydroxy acid, alpha hydroxy acid, and then also more powerful treatments as well, like perfect peel, to really take down sun damage or pigmented skin, pigmentation, aging skin, fine lines and wrinkles, all of those things we treat in clinic. So thank you very much for watching. Thank you so much for your attention. I look forward to sharing another newsletter with you next week.